Okay, everyone's supposed to get a booster shot. Biden's talked about it. Fauci's said how important it is. Private businesses and cities across the country are mandating vaccines. But now a new study out of the University of Oxford is showing that vaccinated individuals with breakthrough infections carry just as much of the Delta variant virus as the unvaccinated. What does this mean? Joining me now is Dr. Harvey Risch, epidemiology professor at the Yale School of Public Health. Dr. Risch, good to see you tonight. So the regular person who doesn't read all these studies or focus on all the new medical data, they're hearing that they now have to go out and get the third shot. And they have to get it at a particular time frame after the last shot. And yet now they're reading that people with the vaccine who have these infections are carrying an enormous amount of virus. And I guess then transmitting the virus to others. And they're still having to wear masks and all the other things, all the other restrictions. So what's the point if this study is correct about the viral loads?
Good to talk to you, Laura. The study is correct about the viral loads, but the gist of the study is talking about what happens to the person who gets vaccinated, not transmitting the virus. And our questions, mostly for government policies, mandates, and things like that, concern risks of transmission. And what this study shows is it suggests that risks of transmission in vaccinated people are not substantially different today with the Delta variant than risks in unvaccinated people. And that's a big and an important difference than what we've been led to believe. Sure, we want the vaccines to reduce risks to individuals, to lessen the severity, lessen the risk of infection. But as a society, we want the vaccines to reduce the risk of transmission, and we're not seeing that.
Well, the good news is that the elderly do seem to get, especially the elderly, do seem to get a huge benefit on the hospitalization front, other vulnerable people. But when we were initially hearing about the new vaccines, we did understand that they had more of a neutralizing effect on the virus, correct? Or am I misremembering that?
Yes, they were more effective at that time because we were dealing with the original strain and the UK, the Alpha strain. Those are now mostly long gone. In the last month or so, we've had the Delta strain, which is different enough that the antibodies that the vaccines make are not as capable as they would have been for the original strains. And in fact, these vaccines are becoming obsolete as more and more changes to the virus occur.
Dr. Risch, one more question. Now it looks like they're mandating that children as young as 12 get the vaccine in certain school systems. The Culver City school system in California, a lot of parents there who, for whatever reason, have their issues with the vaccine are up in arms. Your brief comment on that.
The parents are right. There's the rationale for vaccinating children who largely do not transmit the virus to adults, to teachers, and so on. There's no logical reasoning for that. And the hazards that we don't know about what's going to happen for children who have to live their whole lives having been vaccinated with an unknown quantity, it's too big an uncertainty for too little benefit.
Dr. Risch, good to see you tonight.